Treatment for type 1 and 2 diabetes. Diabetes type 1 and type 2 definition and facts. Controlling blood sugar glucose levels is the major goal of diabetes treatment, in order to prevent complications of the disease. Type 1 diabetes is managed with insulin as well as dietary changes and exercise. Type 2 diabetes may be managed with non-insulin medications, insulin, weight reduction, or dietary changes. The choice of medications for type 2 diabetes is individualized, taking into account the effectiveness and side effect profile of each medication, the patient's underlying health status, any medication compliance issues, and cost to the patient or healthcare system. Medications for type 2 diabetes can work in different ways to reduce blood glucose levels. If you are watching this video for the first time, please kindly like this video, hit the subscribe button, and click on the bell icon so that anytime I make a video like this, you will be notified. Thank you. Abdul. They may increase insulin sensitivity, increase glucose excretion, decrease absorption of carbohydrates from the digestive tract, or work through other mechanisms. Medications for type 2 diabetes are often used in combination. Different methods of delivering insulin include syringes, pre-filled pens, and the insulin pump. Proper nutrition is a part of any diabetes care plan. There is no one specific diabetic diet that is recommended for all individuals. Pancreas transplantation is an area of active study for the treatment of diabetes. Type 2 diabetes diet. A type 2 diabetes diet is based on eating foods low on the glycemic index, for example, fruits, vegetables, whole wheat, brown rice, steel-cut oatmeal, beans, lentils. Read more about a type 2 diabetes meal plan. What is diabetes? Diabetes mellitus is a metabolic disease characterized by high blood sugar glucose levels that result from defects in insulin secretion or the body's ability to use insulin. Normally, blood glucose levels are tightly controlled by insulin, a hormone produced by the pancreas. Insulin lowers the blood glucose level. When the blood glucose elevates, for example, after eating food, insulin is released from the pancreas. This release of insulin promotes the uptake of glucose into body cells. In patients with diabetes, the absence of insufficient production of or lack of response to insulin causes hyperglycemia. Diabetes is a chronic medical condition, meaning that although it can be controlled, it lasts a lifetime. In type 1 diabetes, the pancreas cannot produce insulin. Type 1 diabetes was formerly known as juvenile diabetes or insulin-dependent diabetes. Type 2 diabetes is more a result of insulin resistance, cells not being able to use insulin effectively or at all. It was formerly known as adult-onset diabetes or non-insulin-dependent diabetes. What is prediabetes? How is it treated? Prediabetes is the term used to describe elevated blood sugar glucose that has not yet reached the level for a type 2 diabetes diagnosis. It can be treated by lifestyle changes such as consuming a healthy diet, weight loss, and regular exercise. What is the treatment for diabetes? The major goal in treating type 1 and type 2 diabetes is to control blood sugar glucose levels within the normal range, with minimal excursions to low or high levels. Type 1 diabetes is treated with insulin, exercise, and a type 1 diabetes diet. Type 2 diabetes is treated first with weight reduction, a type 2 diabetes diet, and exercise. Diabetes medications, oral or injected, are prescribed when these measures fail to control the elevated blood sugars of type 2 diabetes. If other medications become ineffective, treatment with insulin may be initiated. Medications for type 2 diabetes. Note that these medications used to treat type 2 diabetes are typically not used in pregnant or breastfeeding women. At present, the only recommended way of controlling diabetes in women who are pregnant or breastfeeding is by diet, exercise, and insulin therapy. You should speak with your healthcare professional if you are taking these medications, are considering becoming pregnant, or if you have become pregnant while taking these medications. Medications for type 2 diabetes are designed to increase insulin output by the pancreas, decrease the amount of glucose released from the liver, increase the sensitivity response of cells to insulin, decrease the absorption of carbohydrates from the intestine, and slow emptying of the stomach, thereby delaying nutrient digestion and absorption in the small intestine. A preferred drug can provide more than one benefit, for example, lower blood sugar and control cholesterol. Varying combinations of medications can control diabetes. Not every patient with type 2 diabetes will benefit from every drug, and not every drug is suitable for each patient. The medications for type 2 diabetes fall into specific classes based upon the way they work to achieve control of blood sugar. These drug classes include type 2 diabetes diagnosis, treatment, medication. Diabetes diet. Proper nutrition is essential for all people with diabetes. Control of blood glucose levels is only one goal of a healthy eating plan. A diabetic diet helps achieve and maintain a normal body weight, while preventing the common cardiac and vascular complications of diabetes. There is no prescribed diet plan for diabetes and no single diabetes diet. Eating plans are tailored to fit each individual's needs, schedules, and eating habits. Each diabetes diet plan must be balanced with the intake of insulin and other diabetes medications. In general, the principles of a healthy diabetes diet are the same for everyone. Consumption of various foods in a healthy diet includes whole grains, fruits, non-fat dairy products, beans, lean meats, vegetarian substitutes, poultry, or fish. People with diabetes may benefit from eating small meals throughout the day, instead of eating 1 or 2 heavy meals. No foods are absolutely forbidden for people with diabetes. Attention to portion control and advanced meal planning can help people with diabetes enjoy the same meals as everyone else. Glycemic index and glycemic load are further considerations in considering a meal plan for people with diabetes. Foods with low glycemic index and load raise blood sugar more slowly than high glycemic index load foods. Glycemic index refers to a standardized measurement, while glycemic load takes a typical portion size into account. Meal timing and amount of insulin administration are considerations when planning a diet for people with type 1 diabetes. Weight reduction and exercise. Weight reduction and exercise are important treatments for type 2 diabetes. Weight reduction and exercise increase the body's sensitivity to insulin, thus helping to control blood sugar elevations. Treatment of diabetes with insulin. Insulin remains the mainstay of treatment for patients with type 1 diabetes. Insulin is also important therapy for type 2 diabetes when blood glucose levels cannot be controlled by diet, weight loss, exercise, and oral medications. Ideally, insulin should be administered in a manner that mimics the natural pattern of insulin secretion by a healthy pancreas. However, the complex pattern of natural insulin secretion is difficult to duplicate. Still, adequate blood glucose control can be achieved with careful attention to diet, regular exercise, home blood glucose monitoring, and multiple insulin injections throughout the day. Various formulations of insulin differ in the pharmacokinetics, i.e., the amount of time until they begin to work and the duration of their action after injection. These different insulins allow for more tailored regimens to optimize blood sugar control. The types of insulin currently available are: rapid-acting insulin begins to take effect 5 minutes after administration. Peak effect occurs in about 1 hour, and the effect lasts for 2 to 4 hours. Examples are insulin Lispro, insulin Aspart, and insulin Glulisine. Regular insulin takes effect within 30 minutes, peaks at 2 to 3 hours after injection, and lasts 3 to 6 hours total. Intermediate-acting insulin typically begins to lower blood glucose about 2 to 4 hours after injection, peaks 4 to 12 hours later, and lasts about 12 to 18 hours. Long-acting insulin takes effect within 6 to 10 hours. It usually lasts for 20 to 24 hours. The long-acting insulin analogs include Glargine and Detamir. They lower glucose levels fairly evenly over a 24-hour period without major peaks or troughs. Different methods of delivering insulin. Not only is the variety of insulin preparations growing, so are the methods for administering insulin. Pre-filled insulin pens. In the 20th century, insulin was available only in an injectable form that required carrying syringes, needles, vials of insulin, and alcohol swabs. Clearly, patients found it difficult to take multiple shots each day. As a result, good blood sugar control was often difficult. Many pharmaceutical companies now offer discreet and convenient methods for delivering insulin. Insulin pumps. An insulin pump is composed of a reservoir similar to that of an insulin cartridge, a battery-operated pump, and a computer chip that allows the user to control the exact amount of insulin being delivered. The pump is attached to a thin plastic tube, an infusion set that has a cannula like a needle but soft at the end through which insulin passes. This cannula is inserted under the skin, usually on the abdomen. The pump continuously delivers insulin, 24 hours a day. The amount of insulin is programmed and is administered at a constant rate, basal rate. Often, the amount of insulin needed over the course of 24 hours varies, depending on factors like exercise, activity level, and sleep. The insulin pump allows the user to program many different basal rates to allow for variations in lifestyle. The user can also program the pump to deliver additional insulin during meals, covering the excess demands for insulin caused by eating carbohydrates. The most exciting innovation in pump technology has been the ability to combine the pump in tandem with newer glucose sensing technology. This is called sensor-augmented insulin pump therapy. A newer option involves devices that use sensors that communicate directly with the insulin pump. One device is approved by the FDA that is a hybrid system, not fully automated, in which the basal insulin doses are automatically adjusted depending on results from the sensor. Users need to manually request insulin doses prior to meals. For more information on how to best cure diabetes, I have left a link in below for the best option available. If you have any questions, please leave a comment below and I will respond to it. Thank you.